Hi, everyone. Thanks for bearing with us for a few minutes and hanging in there. I see we have several people that are here. We've just had some computer issues, so we're just waiting for our presenter to join us, and then I'll get us started. So again, thank you so much for your patience. We'll begin in just a minute or two.
Hi. Hello.
Hi, Kelly. Thank you for joining us. And
You're
thanks for
welcome.
being patient. Sorry for the computer issue. I know we're starting a few minutes later than we planned, so I'm just gonna jump right in and kind of get us going. First, I just want to welcome everybody this evening, and I am so glad you could join us for our presentation entitled Alcohol, Marijuana, and Adderall, Oh My. I'm so glad that you could all be here. My name is Katie Boggs, and I am co-chair of the Mental Health Committee, PTSO committee at Myers Park. And Kylie and Holly are also members of co-chairs of the committee. And Kylie is going to introduce our presenter this evening. And I'll just turn it over to her.
Thanks, Katie. Can you hear me okay?
Mhm.
Thank you. So I'm Kylie Thiel, and we are so grateful that Kelly Little has joined us again. Kelly Little received her master's in social work from the University of North Carolina, Charlotte in 2014. She is a licensed clinical addiction specialist and certified clinical supervisor. Kelly has been working in substance use disorder treatment since 2011, specializing in the treatment of adolescents. Currently, Kelly is employed as the clinical supervisor at Dilworth Center, a local intensive outpatient treatment program for substance use disorders. In addition to supervising the clinical staff, Kelly works directly with the adolescent patients and their family members. Kelly finds her work to be an honor and a privilege, and she is able to see families heal through recovery. We are so grateful again for you joining us tonight. Thank you, Kelly.
Thank you. I appreciate it. Hopefully you guys can hear me okay. I'm going to take a second. Good. Okay. Uh-oh. It looks like it says the host has disabled my ability to screen share. So I don't know if we can get that going so I can share PowerPoint. Yep, you're good. Take your time. While she is trying to figure that out, I will go ahead and dive in because I certainly want to respect everyone's time. I am Kelly Little. I work at Dilworth Center. We are an outpatient treatment center in Charlotte. I primarily work with adolescents and young adults and their families who have been addicted by substance use and abuse and or addiction issues. So, let's see. Today we're going to be talking about addiction a little bit, but we're also just going to kind of back it up a little bit because I'm certain that many of you are coming to the table at different points in this spectrum. Some of you may be coming with younger adolescents who haven't yet had the opportunity to experiment with substances and just kind of trying to figure out what to do as a family system as you start navigating adolescence into young adulthood. Some of you might be coming to the table with adolescents who have started to experiment and just, again, trying to learn how to navigate. And some of you may be here with a little bit of concern about your adolescence experimentation or use of substances. And so I, again, want to respect all of the spaces that you guys are in and talk a little bit about each one of those points. Let's see, it looks like I can share. So let me see if I can get a PowerPoint up here. Okay, so please feel free to ask questions as we go along. It looks like there is a Q&A box. That's probably going to be the easiest way for me to look at questions if you've got them as we go along. But just to kind of dive in, I wanted to start by exploring what trends we're seeing in adolescent substance use these days, especially in the Charlotte area. This is a somewhat comprehensive list of the drug categories that we see at Dilworth Center, and certainly categorized in what I would say would be kind of classes of drugs, but also access of drugs for adolescents. So that first 3 bullet points at the top is what kids are accessing first and foremost, they're what many of us were able to access back in our adolescent and young adult days. So not a whole lot has changed with the exact substance that we're using. What has changed is how the substance is being used, and the potency of the substance. So alcohol is still the number one used and abused drug of all of the drugs combined for any age, including adolescents. We still see a lot of alcohol use. I think there's a misconception maybe in our society that marijuana is more prevalent than alcohol. Certainly marijuana is more prevalent than it ever has been, but alcohol is still more accessible for many adolescents, largely because most homes have alcohol in them. So it's an easy way for them to just start sneaking a little bit from the vodka bottle, filling it up with water, the classic trick. So many adolescents will start with alcohol still. Marijuana is the second most used and abused substance for adolescent populations. And marijuana comes in a lot of different forms now. So marijuana traditionally has been plant, flower, smoked in bongs or cigarette-like modalities. Nowadays, you can get vapes and cartridges with a waxy substance that is a much more potent form of THC, which is the active ingredient in marijuana. So basically what we're seeing with marijuana is just a massive increase in the potency of the drug. The amount of the drug that we are inhaling or ingesting has increased dramatically. So we're also seeing addiction rates rise dramatically with marijuana. There's also a misconception in our society that marijuana is not an addictive substance, and that is not a true statement. Marijuana is absolutely an addictive substance. The potential for addiction is a little bit lower than some other drugs like opiates or heroin or meth, but still a very addictive substance. Actually, the addiction rates of marijuana are higher than the addiction rates of alcohol, which we know objectively alcohol is an addictive substance. So you can definitely become addicted to marijuana, especially with the increased potency. You may notice out to the side from marijuana, I've already mentioned wax. But one of the things that we're seeing in North Carolina, although technically marijuana, THC, is illegal in North Carolina still for recreational or medicinal purposes, there are some chemical compounds that are very similar to THC that are not technically illegal in North Carolina. So it's a little bit of a loophole. But if you think about chemistry, basic chemistry, THC, the active ingredient in marijuana that gets us high, is delta 9. That's the chemical compound. So there are substances like delta 8 and delta 10, but I would say primarily delta 8 that are technically not illegal in North Carolina and can then be sold in smoke shops and different places around town. So we're seeing a lot of adolescents able to buy substances, particularly delta 8, in the same kinds of forms that we would buy THC. So there's delta 8 flower, there's delta 8 that you can smoke in a bong, there's also delta 8 vapes and cartridges and edibles and all of these kinds of things that we would think of traditional marijuana comes in the same form with delta 8. So I would say one of the things that I've seen really over the past 2 to 3 years is a dramatic increase in kids coming to me addicted to delta 8. Which really is extremely similar to delta 9. It's going to give us a similar effect as delta 9. What a lot of these kids are saying they are using, whether that's to their parents or to schools if they get caught or whoever else, they're saying that they're using CBD. They're not using CBD, they're actually using delta 8. So it's really important if you are kind of starting to engage in that cycle of finding your kids using and exploring what they are using, really looking at the substance and seeing if it's delta 8 or CBD. More than likely it is delta 8. CBD is an active ingredient in the marijuana plant, but CBD will not get us high. So CBD is the active ingredient in marijuana that has more medicinal qualities, whereas things like delta 8 and delta 9 will get us high. So there's not a whole lot of use outside of maybe helping to calm seizure activity or anxiety with CBD. There's not a lot of recreational use of CBD in the purpose of getting high. Tobacco or nicotine is definitely still a big substance of use and abuse in adolescence. I was talking recently with actually some patients and some staff members about my particular generation. I'm in my early 30s. We were kind of the generation of let's try to quit quit nicotine. So we really decreased, we had a major decrease in the trend of nicotine use, really kind of stomped out cigarette use. And as my generation got older, vapes became a really big thing. So this new generation is smoking fewer cigarettes, but they're smoking a lot more vapes. What we know about vapes is very little. Really, we don't know all of the substances that are in the vape juice. Companies are not required to report. There's not a lot of FDA regulations, so they're not required to report all of the chemicals and substances that are in the vape juice. And we also know that the concentration of nicotine in vapes is significantly higher than it would be in something like a cigarette or a cigar. So again, addiction potential increases dramatically with vape use versus cigarette use, even though addiction potential is pretty high with cigarettes as well. So these are the three substances that we're seeing the most in adolescence. I'm actually going to jump down to the very bottom. Those last three, I would say, are the next substances of experimentation that we're seeing in adolescence. So certainly a lot of craze around hallucinogens like LSD and mushrooms. I would say with adolescents, because these are such unknown substances, it's not uncommon for me to see adolescents who are buying mushrooms, but really they're just getting mushrooms from the grocery store, and they're not actually getting high off of them. Some kids are able to access mushrooms that they are getting high off of. So that's definitely something we're seeing with adolescents. LSD is something that a lot of kids think they're using. So these tabs are being sold as LSD to the adolescents. But LSD is really not a drug that's in circulation right now. So when your child, or even in adulthood, if you're being sold an LSD tab, more than likely it's what we call research chemicals. That's that second bullet point with a question mark on it. And there's a question mark on it for a really good reason, because at the end of the day, we really just don't know what the chemicals are. It's probably a random composition of chemicals that some lab scientist turned drug dealer has sprayed on that tab and sold as a hallucinogen. So in theory, it will simulate the effects of LSD, but they're very unknown. So one of the things that we're seeing is a lot of kids having an experience with LSD, experiencing psychosis, and having trouble getting out of that psychosis. So ending up in the hospital days or weeks later, still experiencing the trip or the hallucinations or whatever the psychosis is associated with the LSD, just because the research chemicals are so unpredictable and we don't know how they're going to affect our brains and bodies. So that's a wild card, if you will, in terms of substances that adolescents are accessing. Ecstasy, I would say, is a little bit less common in adolescence, a little more common in young adulthood, but ecstasy is more often like a concert kind of a drug or a party kind of a drug. So we're not seeing as regular use with ecstasy, which is the same thing as MDMA and Molly. We're seeing that more like if a kid is going to go to a music festival or something like that, they might be interested in using that substance. And then those middle four are substances that we're seeing some experimentation with adolescents. I would say more often we're seeing experimentation, use, and abuse in young adult populations with these substances. Those middle three, benzodiazepines, opiates, and amphetamines, can be prescription medications. So one of the things that I always encourage parents just to be cautious of and aware of is if your child, for example, gets their wisdom teeth out. The doctor may or may not give you a prescription or give them a prescription of something like hydrocodone, when really the pain of wisdom teeth surgery can be managed, barring any major infection or issue with the surgery, can be managed with Tylenol and ibuprofen. So one of the stories that we hear commonly with the kids and young adults that we're treating is that their first exposure to these drugs that they end up being addicted to was through a medical capacity, like getting their wisdom teeth out or breaking their arm or having a surgery after a gymnastics injury or something like that. So just being really careful and cautious about the prescriptions that your children are being given. Same thing with amphetamines. One of the things about North Carolina that has been a longstanding issue is that we're one of the most overprescribed states for amphetamines. In fact, we were #1 at one point. I'm not sure exactly where we are on the list now. I know we're still near the top of the list. But we've seen coming out of COVID, a lot of adolescents and young adults seeking prescriptions for amphetamines because they think they have ADHD because they're having trouble focusing. But what's really happening is that we're just really struggling to adjust back to a less technology driven world and or a more technology driven world, depending on where you are in life or what you're doing. And also increased screen time and decreased social activities over COVID really disrupted brain development. And so a lot of kids are having slowed brain development, particularly in the frontal lobe where decision-making skills and logic lies. And so it presents similar to ADHD, but it's really not ADHD. So they're getting a prescription for Adderall, thinking they have ADHD when it's actually not an accurate prescription. So another thing that I often encourage parents to explore, if your child is coming to you and saying they're having trouble focusing, that's probably a very legitimate concern that needs to be addressed. I would encourage you to start with a psychologist instead of a psychiatrist. So a psychiatrist is a medical physician. Same thing with going to the pediatrician. So these people are going to go straight to, is medication an option that we need to explore, and maybe give you Adderall to see if that helps. Whereas a psychologist is going to do some really comprehensive psychological testing to really understand if there is an accurate diagnosis of ADHD or not. And then we can have a conversation about medications. So getting that accurate diagnosis and meeting with a psychologist and or a therapist first is always a great recommendation for parents. It's maybe not that immediate gratification that we sometimes want, but really in the long run is going to set your child up for better success if we have an accurate diagnosis before we jump straight to medications. I will touch on fentanyl and kind of the opiate crisis. Luckily, in this area, we are seeing fewer adolescents abusing opiates. We're seeing more young adults abusing opiates. But again, it's certainly something that kids are exposed to in high school years, whether that's through a prescription or recreationally. And beyond actively using opiates, we are seeing more and more substances laced with fentanyl. In fact, we're seeing a good amount of even things like marijuana laced with fentanyl. So fentanyl is a really strong opiate. It's traditionally used in surgeries or really significant medical complicated issues. It was really never meant to leave hospital settings outside of like end-stage cancer patients. It is a powdery substance that can be sprinkled in or on pretty much anything, and it increases the potency of the substance. So that's why drug dealers put fentanyl on other substances, because it makes them stronger, and a substance user likes a stronger substance typically, particularly when we're developing tolerance and wanting a higher high. And so it makes the substances more desirable to a substance user if they're stronger. The thing with fentanyl is that it takes a very, very small amount of fentanyl to create an overdose. So it's like a tenth of a grain of sand can create an overdose on fentanyl. So very, very small amounts. And it's just unpredictable. So the analogy I use is like if you're making chocolate chip cookies and you throw a bunch of chocolate chips into the batter, when you scoop out the individual cookies, are they going to all have the exact number of chocolate chips in them? No, they're not. So the same thing happens when we sprinkle a little bit of fentanyl in a big pot of marijuana flour. When we divide it into little baggies, different baggies will have different amounts of that fentanyl. And so it's, again, kind of a wild card in how much you're getting, if you're getting any, and whether that can produce an overdose. So I say all of these things not as scare tactics, just as education. I think it's important that we're going to talk more in a minute about what parents can do. But I think one of the most important things is to have open conversations and to educate our kids as they're navigating the world and trying to make decisions on their own. Benzodiazepines, these are anti-anxiety and sleep medications. We're seeing very, very little experimentation and or prescriptions in adolescents. Luckily, that's more of a young adult experience. But these substances are chemically very similar to alcohol. So we're seeing especially a lot of college-age students using, maybe they don't want the calories of 3 drinks. So they'll drink one drink and have half of a Xanax to kind of synthesize the same effect of 3 drinks in alcohol. However, these substances can be laced with fentanyl and also are a little bit more unpredictable in how they affect our bodies. So we are seeing some overdoses from the combination of those substances. And then cocaine is the last thing. We do see experimentation with powder cocaine in adolescent populations. It's certainly something that circulates the party scene in Charlotte. But again, is a little bit more of a young adult substance when it comes to addiction rates. Monitoring the Future is a really cool study that is done every year in the United States. It's certainly something you can look up. It's public data, so I encourage you to look it up if you're interested in this. I put this specific slide in here because I think it's good news. This was actually from 2021 data. They are just now coming out with the 2022 data, so I will update that slide accordingly when all of that data is out. But basically what it indicated is that there wasn't a massive increase in substance use and abuse from pre-pandemic to post-pandemic. I think there was a pretty significant increase in things like anxiety and depression. I know a big study just came out last week about suicide rates increasing pretty significantly since pre-pandemic. I think this year was the highest suicide rates among adolescents ever. But we're not seeing as significant of an increase in drug use and abuse trends, which is good news. But again, there's a lot more data with Monitoring the Future. They assess 8th, 10th, and 12th graders every year across the country on substance use and abuse trends. So a really cool study to look into. I didn't make this slide. This came from Karen, which is a treatment center, inpatient treatment center we refer to often. But I really liked it. I thought it captured a lot of really important facts about the adolescent brain. And really, ultimately, what I want to communicate to you is the adolescent brain is all about instant gratification. So that frontal cortex that I explained earlier, the frontal lobe, that's the last part of the brain to fully develop. And an adolescent brain is significantly underdeveloped. We have come to learn that the brain doesn't fully develop normally until about age 25. I'll be interested to see if post-COVID, we're seeing that it's even further beyond 25, just because of some of the things I've already said about brain growth slowing with the way that our society was altered throughout COVID. But regardless, because that frontal lobe is underdeveloped in adolescence, we are not good in our younger years about playing that tape through. So really looking at consequences, really thinking through our decisions, having logical thought processes. What we are driven by is our limbic system, and our limbic system likes instant gratification. What feels good? What feels cool? What's going to make me happy? What's going to be fun? Those kinds of things. And we crave that really strong. So if we have an experience like we get our wisdom teeth out and we have an opiate and it makes us feel really good, our brain is going to lock in on that experience, and our brain is going to crave that experience moving forward. So we may say, okay, opiates made me feel really good. I wonder if alcohol will do the same thing. And so it just gets those wheels turning in our brain in adolescence. Doesn't necessarily mean that we're doomed, but it certainly is the way our brains work in adolescence. So this is why legal drinking age is 21. They're kind of going back and forth with nicotine, tobacco, about 18 to 21, because really we want to get us as close to that fully developed brain as possible before we're introduced to some of these instant gratification substances. Humans in general are driven by instant gratification, but the adolescent brain even more so. So thinking about kind of every adolescent is going to experiment with something, whether it's substances, whether it's sex, whether it's risky behavior. That's kind of the natural developmental stage of adolescence. We like to test boundaries. We like to figure out what works for us, what we can get away with. We're supposed to do that as adolescents. It is unhealthy, arguably, if an adolescent is not doing that. So that's a piece of the puzzle just to consider as you're navigating this with your families. Another piece of the puzzle to consider is that some people can experiment successfully and healthfully, and others are not going to be as capable of that. So this list, I think, can be really helpful for family systems to maybe even sit down and go over and kind of think about, okay, child in ninth grade, or really arguably before that. I think sometimes we wait until it's too late, until they've already started experimenting before we start having these conversations. But irregardless, at any point, sitting down and saying, hey, let's kind of go through this list and just make sure that you are educated on yourself, your brain, your body, your susceptibility for developing addiction before you make choices about experimenting. So this is a somewhat comprehensive list of the things that make a person more susceptible to developing addiction. And really, again, important things to talk about with your children, sometimes uncomfortable things to talk about with your children, sometimes things that we run away from talking about, but really important for us to face that and have these open conversations. So the first thing on the list is adverse childhood experiences or experiences of trauma. So you can look up adverse childhood experiences. It's a list of, I think, 12 different experiences that children can have growing up. Things like divorced families, growing up in a home with abuse or substance abuse, things like that. So really kind of any disruption in our childhood, any traumatic experiences or experiences of abuse certainly increase the likelihood of developing addiction down the line. Oh, I was going to say something, it escaped me. I'll see if I can come back from that. But adverse childhood experience, adoption is what I was going to say. So any kind of, disruption in our home environment, major changes in our childhood, even if we can't remember it. So a lot of times I'll hear parents say, well, they were adopted at birth, or they were adopted at 5 months, so they don't remember any of those things. But one of the things that we know from a scientific perspective is that our brains and our bodies store these traumatic experiences or these really big changes, even if intellectually or logically we can't remember the details of the experiences, we've maybe captured it in our bodies. So even if it happened to your child or to you before the age of remembering, it counts as something that can increase our susceptibility to developing addiction. The next thing is co-occurring mental health disorders. So this would be things like ADHD or ADD, anxiety, depression, post-traumatic stress disorder, bipolar disorder, really any autism, autism spectrum disorder, any mental health condition can increase our susceptibility. Just really simply, what we know about any kind of mental health disorder is that it's largely a misfiring of neurotransmitters in our brain. So things like dopamine, serotonin, all of these kinds of feel-good chemicals are either not absorbing correctly, or we have too much or too little, or our cells aren't working correctly. And again, very simply, what drugs and alcohol are a synthetic boost of these neurotransmitters in our brain and our body. So if we already have a disruption or some incongruencies going on in our brain and body with these neurotransmitters, and we're putting an overload of synthetic neurotransmitters in our body, we can kind of see how those might clash and create a substance use disorder or an addiction issue. Family history of addiction, and this is definitely one of those that I think many families sweep under the rug. When we have generations of addiction within our families, there can be feelings of guilt and shame, and addiction thrives in secrecy. And so many of us in addicted family systems are taught to not tell people, not talk about it, for various different reasons. And so a lot of times we aren't passing down that knowledge. When we know that there's addiction issues in our family, we're not talking about it. But it's really important to let your kids know, if you have addiction on one side of your family, it increases your chances 50% of developing addiction. If you have it on both sides of your family, it increases your chances 75%. And that increases even more if it's actively going on in your home when you grow up. So if there's active addiction or alcoholism in your home growing up, those chances increase even more. The next one is age of first use. So this is any use of any mood or mind altering chemicals. So I mentioned the wisdom teeth surgery. So if we've never experimented with anything ever, but at 15 we get our wisdom teeth out and we have an opiate, that's our age of first use. Or, if we're an 18-year-old high schooler and we're going on spring break and we've never experimented with anything and we have our first sip of alcohol, that's our age of first use. So the earlier, the more likely a person is to develop addiction. So I think the statistics are between 13, or really could be before 13 and 21. And then also, if you don't try anything until after you're 25, those are kind of the two areas that your chances increase the most. But again, the earlier, the more likely you are to develop addiction. And then the last thing is a concussion. So any kind of head injury, any kind of traumatic brain injury. We see a lot of athletes come to the table with addiction issues because they've had these traumatic brain injuries and concussions. Again, if we think about drugs and alcohol and how much they affect our brains, if our brains are already compromised, the likelihood of us not being able to handle those drugs and alcohol is a little bit higher. So again, not everything comprehensively, but a pretty succinct list that we can go over with our families and just be educating about, okay, if you're checking off a lot of these boxes, you might not be able to use marijuana on the weekends like your friends can, because for you, it might not be enough. It might be something that develops into an addiction. And you might want to stay away from that, even though you're seeing that your friends can handle it and do it in a way that's not destroying their lives. You might not be able to do that. This is an assessment tool for you parents to kind of think about or go over with your kids, particularly for those of you who are starting to experience a little bit of concern for your adolescents who might be experimenting with substances. So the first one is, have you ever ridden in a car driven by someone who has been using or drinking? So the like willingness to be in those risky situations is certainly a concerning factor. Have you ever used to relax, feel better about yourself, or fit in? So there's this kind of healthy, natural experimentation in a social setting. Everyone's doing it. I want to see how it feels. That is different than, I took my parents' alcohol and I drank a beer in my room alone because I was feeling really sad and really lonely, or I took a shot of vodka before school because I have a lot of anxiety going to school and I don't feel like I fit in, and it just helps me kind of calm down. So these kinds of things, the motive for why they are drinking is important to evaluate. That kind of leads me to my next point. If they're drinking alone, that's another red flag. Again, kind of the social experimentation versus isolating and doing it by themselves. Do you forget things while you're using? That certainly would indicate significant use or abuse of a substance. And have people started expressing concern? So one of the things that I really look for when I'm assessing an adolescent is, have people other than just their parents expressed concern? Because naturally parents are oftentimes the first ones who kind of clue in and are concerned about their child and wanting their child to thrive. When we start hearing that friends have expressed concern, or a girlfriend or boyfriend have expressed concern, or maybe even broken up with them, or maybe friends have distanced themselves from the person because of their use and abuse, those things are even more concerning than just the parents being concerned. And then, have you ever gotten in trouble while using? So basically, addiction is continued use despite negative consequences. So a user who is a quote unquote normal user who has not developed addiction, when given enough reason, will stop. So if a person is continually experiencing consequences from the substance use and continuing to use, or maybe even using more and more, that would certainly indicate that the progression of addiction has started, or that they're at the point of needing help. Speaking of progression, so we know that addiction is a progressive disease, as are most diseases. If you think about cancer, there's lots of different stages of cancer because it can get worse and worse. Same thing with Alzheimer's and lots of different medical conditions. So addiction is no different than that. These are some things to kind of look out for in your kids if you're starting to experience those concerns. So the crucial phase, this would be like that first line of defense where we're starting to notice things aren't going great and substances might be building up a little bit. They might be using a little more than we're comfortable with. But we're also seeing that their grades are dropping a little bit. Maybe a couple friends have stopped hanging around, or maybe a couple new friends have started hanging around and we're not quite sure about them. Their frustration tolerance has decreased a lot, so much more irritable, easily triggered. If I ask them if they've done their homework, they're blowing up, whereas before, they would have had a calmer response. Families and friends become concerned, Discontinuation of hobbies is a big thing that I see. So a lot of people saying, he played soccer, he was on so many teams and he was the star until he hit, end of ninth grade, and going into 10th grade, he just did not want to play soccer anymore. They were gymnastics superstar, and all of a sudden they stopped trying as hard and ultimately quit the team. Those kinds of things are, changing interests, maybe changing appearance or changing the way that they're taking care of themselves. And then just a little less interested in important things like work or school, increased truancy, starting to miss class or work, those kinds of things, just not caring quite as much about their responsibilities. The chronic phase would basically be an increase in all of those things. So just we're seeing more use, we're catching it more. It seems to be constantly going on. We've asked them to stop. We've tried to help them stop. They haven't been able to stop. Maybe they've picked up a DUI or a possession charge or something like that. Again, just continued emotional deterioration, continued decrease in frustration tolerance. We're noticing that everything revolves around the drug. So now they've got a poster on their wall of whatever the drug is. All the music they're listening to involves the drug. All the people they're following on Instagram, all of a sudden their Snapchat is full of people posting videos of them smoking. So just kind of noticing that it's infiltrating every area of their life. No longer interested in anything, including work and school, vague desire for help. And then every once in a while we'll see, okay, look at me, I shaped up. You caught me for the last time. You told me you were going to send me to treatment. Okay, I'll do better. I'll do better. And they're able to stay sober for a week or two, and things get better, and they're not as irritable, and they're nicer, and they're doing their homework. But what we ultimately see is those periods are very short, and that as soon as we loosen the reins, if you will, or kind of turn an eye or think things are better, it goes right back into those old patterns. The good news is if you're seeing that progression with yourself or your kid, there is a rehabilitation phase, and that's where we come in at Dilworth Center. So if you're in that crucial or that chronic phase, calling a place like us would probably be a great place to start so that you can just get some help navigating this, because it's really hard to navigate this. We're not supposed to know how to navigate this. The rehabilitation phase is when we have an honest desire for help. My experience with adolescents is that parents have to hit that honest desire for help before the kid can hit that honest desire for help. And sometimes it takes parents a long time to hit that honest desire for help, because there can be a lot of grief and a lot of fear in coming to realize that your child has a problem and needs sobriety or needs treatment. And so it takes what it takes for parents to get to that point, just like it takes what it takes for a kid to get to that point. But there are great treatment options. There's great therapeutic options. There's 12-step meetings like Alcoholics Anonymous and Narcotics Anonymous. And when we allow a child to engage in those processes, have those therapeutic supports, we then see this improvement in awareness and insight and honesty and kind of all of those things that seem to be falling apart in the crucial and chronic phase. We see them build back over time. It's hard work. I don't want to minimize that, but there's definitely help out there. And I'll have my information on the last slide too. So if you have questions, like I'm not sure, is it time for me to call a place like Dilworth Center, you can send me an email and I can kind of talk you through whether you're at that point or not. So we'll kind of wrap this up in the last 10 or so minutes before we have a little time for questioning, just talking about what you guys can do. So as parents, I think it's really, really important to lead by example. Our kids are watching, they are absorbing at any age, really honestly, starting young. I had an adult patient several years ago whose 3-year-old was talking about daddy's juice. So really kids are very perceptive. And will do what they see others doing, especially people who they love and they trust. So if you're telling them, don't get to the point where you're forgetting things when you're drinking, but you're on a Saturday night getting to the point where you're passing out on the couch and they're having to help you to bed, that's going to be a really confusing message to them. Having open conversations, we've kind of hit that point, but I really think it's important to open the door to your kids and have these conversations about their susceptibility to developing addiction, and your thoughts on experimentation, your thoughts on substance use and abuse, and also taking away shame or intimidation. So traditionally, the way that we've approached substance use and abuse is don't do drugs, drugs are bad. But the reality is kids are smart, and kids know that that's not actually a true statement, because there are some benefits from these drugs that feel good, really, ultimately, at the end of the day. They're objectively not bad. There are some medicinal purposes that are good. And also, they can make us feel good in moderation. So if we can come from this place of education, of taking the shame out of it, not intimidating or trying to fear our kids into saying no, but really just talking about the dangers and the risks, and encouraging them to make low risk decisions, both by making low risk decisions ourselves and also just kind of educating them on what low risk decisions are, we see much more successful outcomes than making it something that is a no-no or scary. Because again, if we go back to what adolescents are supposed to do, they're supposed to push boundaries. So if we are telling an adolescent not to do something, their curiosity is going to be piqued, and their likelihood of wanting to check it out and see if it's a possibility for them might actually increase. So that cycle, that pattern that we've been locked in for generations and generations has not worked. I think luckily we are stepping outside of that cycle these days, but bringing that into our household and not intimidating, shaming, or using fear tactics is really the most successful way of approaching this topic. Setting boundaries. So in my field, we are not big fans of rules. So a lot of times parents will set rules in the household. In my field, we're much more apt to encourage families to set boundaries. Boundaries include logical and consistent consequences. So I'm going to come back to this slide, but real quick, I'm going to go to the next slide. So these are some examples of boundaries. The first one doesn't necessarily have anything to do with drugs and alcohol, but just to give you an example, one boundary in your household, you might say, you know what, I am not comfortable with, I am not okay with lying or calling in sick for you. That doesn't align with my values and morals. That doesn't make me feel good. And I really don't think it's ultimately helping you. So my boundary for me is I'm not going to call in sick for you, and I'm not going to lie for you. The consequence is, if you don't get up for school in time, or if you're unwilling to go to school or unable to get to whatever you need to get to, you're going to have to experience the natural consequences of that, whatever that is. Now, as a parent, that might feel very fearful because you want to save them from their consequences. You want your child to thrive and succeed and, you know, not get the detention or whatever the consequence might be. Not be able to not play at the football game because they missed too many days of school or whatever it is. But ultimately, it's such an important lesson for adolescents to learn that all of their choices have consequences. Healthy choices have positive consequences. Unhealthy choices have negative consequences. And when we save them from those consequences, we're really ultimately doing them a disservice. So that's the first boundary. The second boundary does have to do with drugs and alcohol. And this is something that I really encourage every parental set to sit down and talk about. What is acceptable in your household when it comes to alcohol and drugs? So this particular boundary is I will not allow alcohol or drug use while you are in my home, underage, and supported by me. The consequence is if you're using drugs and alcohol, and I know that you're using drugs and alcohol, I will not allow you to drive any of my vehicles. But you'll be able to earn that privilege back once you test negative for all substances at a screening facility. So I really like this consequence because it's logical and consistent, right? If I know that my kid is abusing substances and it's my car, ultimately it's my liability if they end up with a DUI or end up wrecking the car because they've used, et cetera, et cetera. So it makes sense to me if I know they're using, I'm not going to put myself or them in harm's way, and I'm not going to let them drive my car. But the really important piece of this boundary is there's a light at the end of the tunnel. So we give this guideline of you can earn this privilege back. You just have to be testing negative. And I'm going to take you to a facility to get that drug screen. I'm not just going to do it at home because that can cause some conflict, and at-home drug tests are really easy to cheat. So if you're going to drug test your kids, take them to a facility, call your doctor's office and see if they have any recommendations. But there's a light at the end of the tunnel, because I think sometimes adolescents can get locked into this cycle where they're constantly on restriction because they're constantly doing bad things. And at that point, it's like, well, what's the point of me even trying to do better, because I'm just constantly going to be on restriction. So I might as well just really ride this out. So having that piece of the puzzle where they can earn the privilege back, I think is important. And having it really clear on what they need to do to earn that privilege back, because their brains work in black and white. Their brains aren't going to be able to fit the pieces of the puzzle together and kind of read your minds and figure out what you need from them or want from them to get those privileges back. So it's really important to be specific and detailed with adolescents. I think another boundary that I don't have on here is we don't allow drinking and driving in our home, you know, and so if you have been drinking, whether you condone that or not, whether we're okay with you drinking or not, if you have been drinking, we want you to call us, call an Uber, not drive. If we do find out that you've been drinking and driving, you will not be allowed to drive our vehicles. And that may be something that you say that's indefinite. You're not allowed to drive our vehicles indefinitely if you've been drinking and driving. So again, boundaries can be very specific to you. There are so many different boundaries that we can set, but being specific and clear, and also setting them proactively. So the thing with family systems is that we get really reactive. So we don't talk about it, and then all of a sudden our kid gets busted at a party and we have this big dramatic situation where we take all of their privileges. We're reacting to the situation, but we haven't talked about it before. So we have to come up with things on the spot. It can feel very emotionally charged. Maybe it's, you know, we go too far with the consequences and then we regret it and we can't actually follow through with the consequences because we didn't really mean what we said in the moment of emotion. So being proactive and kind of sitting down as a family before you get into the chaos of this is what is okay with us, this is what's acceptable of us, and this is the consequences if you're not kind of falling in line with what feels acceptable in this household. Just takes a lot of the chaos out of those situations in the event that something does happen that crosses your boundaries. Remaining united as a parental unit. So this one can be difficult, especially if there's more than one home. Even if all the parents are in one home, it can be hard to get on the same page. But as much as possible, getting on the same page, adolescents are really good at pitting parents against each other and kind of using one who's a little bit more lenient and getting away with a little bit more. And so that united front is really ultimately a safety net for them, even if they don't like it, even if they react negatively to you being a united front. It's ultimately what's healthiest for them. Don't provide alcohol or drugs to underage individuals. I know I've heard all of the arguments of, well, if they're going to be drinking, I feel safer with them drinking in my home. I think just clinically kind of going back to what we know is happening in the brains of adolescents, it's just really not a healthy idea to condone it on that level and provide alcohol or drugs for underage individuals, particularly if there's other adolescents in your home whose parents may not be okay with that. So blanket recommendation is not to do that. And then keeping prescription medications and alcohol out of reach, locked up or out of the house. I think families can be at varying degrees of this. But I would say just, again, kind of blanket statement, if you have leftover prescription medications that you're no longer using, Walgreens have drop boxes, no questions asked. You can just leave the medication, they dispose of it in a safe way. So those kinds of things are probably not healthy to have in the home. If you're starting to feel concerned about your child's experimentation, you may lock it down a little bit more and remove the alcohol or other kinds of things, but kind of paying attention to what your household needs on that one. And then the last thing that I'll say is asking for professional help. So I think there's a lot of stigma when it comes to seeking therapy and getting treatment for all kinds of diagnoses from a mental health perspective. I'm hopeful that our society is more and more normalizing getting help. You know, it's like if we have the flu, are we going to go to the doctor and get help? Yeah, I still think there's some people who are scared to go get help, or who will push it to the last minute before they go get help medically. But we're more likely to go get help for medical conditions than we are for mental health conditions. So I'm hopeful that is changing and evolving. But normalizing asking for help, normalizing seeking that help before we get to a really chaotic place. If we're starting to notice some things slipping or not doing great, what if we go ahead and proactively get in with a therapist so that maybe we don't have to get to that ultimate stage where we need a higher level of care? When I say seeking help, there's lots of different kinds of help out there. Again, it's a tough field to navigate. So there's all these different levels of individual therapy and family therapy and psych testing and psychiatrists and treatment centers and 12-step meetings, and the list goes on and on and on. So I really encourage you to turn to people that you trust. So we can Google things, but like if you Google Dillwer Center, the first 3 or 4 links are not actually us. It's a random treatment center who paid for ads. So even Googling things can be so difficult to navigate. So I really encourage you to lean into people that you know and trust. So certainly counselors at Myers Park, have been gracious enough to set this up for you guys and to ask me to speak. If you have other, people that who are therapists in the field, or if you belong to a religious community, maybe pastors, but certainly use me. You may or may not know and trust me, but we have been around at Dillwer Center for 33 years now. We're very connected in the community, and we're also really upfront with families if we're not the right fit. So if you don't need us, we are not going to bring you in and waste your time and money. We are going to help you get where you need to go. So use us as resources to help navigate this, and don't try to do it on your own. That's my information there on the screen. Feel free to take it down. And I can email this PowerPoint if you guys want it. If anyone wants a copy of it, I'm fine with that. But please reach out to us so that we can help you get the most appropriate help for yourself and your families, so that you're not floundering in all of this. I feel like I rushed through a lot of that. I want to pause. We've got like 3 minutes left to see. I didn't see any questions in the question and answer, but I wanted to give a moment and see if anyone did have questions or anything that you feel like I didn't hit that you guys wanted to hear about. Okay. Well, I really appreciate you guys. And if you have any specific questions that you didn't want to share with the group, whether they're personal or otherwise, feel free to send me an email. That's probably the easiest way to get in touch with me as a first point of contact. But if we need to schedule a phone call, I'm happy to do that as well. We really want to help our communities as much as possible. Especially, I went to Myers Park, so as a Myers Park grad, I love being able to talk to you guys and to be a resource for you guys.
Well, Kelly, thank you very, very much. I always take notes. I heard you give this talk before, and you always provide such good information. And I feel like it changes a little bit every year, and obviously fentanyl is a big, topic of worry for a lot of parents, and just, bringing that up. And some colleagues of yours spoke to the kids today at school and did a really nice job kind of sharing some of this information with the students at Myers Park today too. So yeah, if nobody is going to type a question into the Q&A, then I'm going to let you go. And I just want to thank everyone for being here again tonight. And Kelly, especially you, for giving your time. We greatly appreciate it. And just so the parents that are here know, this is recorded and we will be posting this on the PTSO website for Myers Park. So if other people, if you thought this was good information, please pass along that people can watch this at their leisure. After we get it posted, it might take a day or two, but it'll be on the website. So awesome. Wonderful.
Thank you guys.
Yes, thank you so much, everybody. Take care and have a great night.
Thank you, Kelly. Oh, she's gone. Bye. Thank you.
Bye. Good night, you guys.
Night. Thanks.
Were we going to talk? Nope.
No, everybody's still on. So we'll talk offline. Bye. Thanks.